Biologic therapies can be very effective in the treatment of moderate to severe psoriasis, but many patients don't experience a sufficient reduction in symptoms with these drugs, and it's currently unclear why. Previous studies have investigated predictors of biologic therapy effectiveness, but these have tended to be studies with fewer patients, which considered fewer potential predictors than in the data available to us. So we wanted to see if we could confirm previous findings and identify other predictors of effectiveness. We also wanted to investigate predictors of differential treatment response, so seeing if certain patients were more likely to respond better to one biologic therapy than another. This was an observational cohort study using the BADBIR, which is a multicentre prospective pharmacovigilance registry for adults with psoriasis. We analysed data from over 3,000 patients who had initiated either adalimumab, etanercept or ustekinumab as a first-line biologic therapy. We performed univariate analysis to investigate the association between around 30 potential predictors and the attainment of a 90% reduction in PASI at around 6 months following treatment initiation. We then performed multivariable logistic regression modelling to collectively analyse the predictors identified in the univariate analyses. We investigated potential predictors of differential treatment response by including interaction terms in the regression models. Our findings agreed with other studies in that a higher weight and smoking were associated with a reduced chance of achieving a good outcome. We also found female gender, non-white ethnicity, unemployment, a lower baseline PASI, psoriasis involvement in the palms or soles, and the presence of only small chronic plaque to be associated with a poor response. There was some evidence that males have a comparatively worse response to etanercept compared to adalimumab than females, but other than that, there wasn't much evidence of any predictors of differential treatment response. This study is relevant because some of the predictors of a poor response to biologic therapy are modifiable factors such as smoking and weight, which underscores the need for better lifestyle management in some patients. Based on our analyses, it's unlikely that we can produce a reliable tool to select the optimal biologic therapy for people with psoriasis based on clinical factors alone. It's possible that an integrated approach across clinical data and omics data will be needed.